If your hormones are so out of balance and you just don't feel like yourself anymore, there is something you can do. Joining me now is Dr. Clark Hansen from the Hansen Clinic of Natural Medicine. It's good to see you, Dr. Hansen.
See you again.
Talking perimenopause. What is perimenopause?
Right. Perimenopause means around the time of menopause. So technically it says 12 months of no periods and you're in menopause. So if you haven't had a period for 12 months, you can be safe that they're probably not going to happen again. But we see this up and down cycling. It's not just a kind of a cut and dry, when does it happen? And a lot of women have this emotional roller coaster before their periods finally stop.
I see.
And the hormones should nice and easily come down together. If they did, it'd be nice and smooth and it'd be over and done with. But we see this kind of jagged one hormone and then the other, and that creates all this imbalance that turns your life upside down.
Well, tell us about some of the patients you've seen and some of their stories and what was happening to them. I know we have a graphic here.
Yeah, recently we had a 51-year-old patient come in, Danielle, who was having, of course, hot flashes, and that keeps her from sleeping, up multiple times at night, multiple times during the day, vaginal dryness, which causes painful intercourse, no sex drive and absolutely no sexual stimulation, no sensation. And she was depressed. Of course, she'd be depressed if your life's upside down with those symptoms. Apathetic, anxious, a lot of fatigue, and her hair was thinning. So those are symptoms of low female hormones as well as low thyroid hormones. So those are some of the key hormones that we need to test to find out really what the balance is doing. So there's 3 different types of estrogens that a woman has, and one of them you'd need more for fertility before menopause, and that's estradiol. That creates secondary sex characteristics in a woman, but too much of that will cause cancer, breast cancer. So we want to look at these tests we did on this patient that gives you those hormones. Look at those 2 estrogens. Estradiol, we call it E2, estriol, E3. Estriol is the safe one. That one's one we want a woman to take after menopause to prevent the night sweats, the hot flashes, the thinning of the skin, thinning of the vaginal membranes. Estradiol is the one that can increase the risk of cancer. So in this woman, she's got low everything, but low estriol, progesterone, and testosterone. Those are the main ones that we want to try to correct to turn around this upside down life that this woman's experiencing. So she was very frustrated and irritable and no sleep. It's just, you can't go on like that.
Yeah, and I think people are understanding the whole bioidentical hormone, but what's the best way to take them? I think that's still, people aren't sure.
Yeah, well, women are afraid to take hormones now because there have been studies about the synthetic hormones actually increasing a woman's risk of cancer, heart attacks, and strokes, and dementia. So you want to make sure you take the right ones. Even bioidentical estradiol can cause problems. So we look at the different types. Estriol is the safe one.
Okay.
And you'll see on the left are the protective ones. It prevents cancer and the menopause symptoms, thinning of the skin, thinning of the bones, thinning of the membranes without the side effects. Estradiol actually increases a woman's risk of cancer, and the synthetic ones. So progesterone, there's a natural safe progesterone, and it's an anti-cancer agent. It builds the bones.
I see.
And the synthetic are called progestins, and those actually do the opposite. They actually increase a woman's risk of breast cancer, and they increase the risk of heart attacks as well. And then there's testosterone. This woman said she didn't have a sex drive, absolutely zero, and no sexual sensation. And you don't want to go through life without those sensations. Those are important.
Wasn't it also energy too, testosterone?
But yeah, it's a lot more. It's
Yeah.
often thought of as just for sex drive or for men muscle building, but it also reduces the risk of heart attacks, and it's a natural antidepressant. So women feel depressed around this perimenopausal time, and it can last years. Perimenopause, as it tries to get into balance, it can last years. So if we look at that screen one more time, so after testosterone, there's also 2 other important ones, DHEA and the natural thyroid.
So all of those you'll look at, and for people who are watching right now who feel like your patient did, you have a special offer, right? You're going to do a screening?
Well, we do a screening. We test for this, and so there's 5 hormones we test. And you need to test all of them to see where they're out of balance, like we're showing there. And we use a sublingual delivery system rather than the pellets injectable, because you can't use the safe estriol for that, and it usually gets it too much out of balance. So go to our website, learn more about the options, the pros and cons, see if you've got these symptoms. You need to really test because it's more than just a nuisance. It will increase your risk of cancer and heart attacks.
And just so I know, the offer that you're offering today is?
It's a free hormone test. If you sign up for the newsletter, you're entered into a drawing. We're going to give away a free hormone test to whoever one of the ones
Winners.
who sign up.
Okay.
And go to the website, just sign up for the newsletter. You're automatically entered for the drawing.
Perfect.
We want to get you more information, but you got to get in and
get
learn
it
about
tested
Get
and know what's
tested.
going on.
Yeah.
Thank you, Dr. Hansen.
Right.
Some good tips there, a lot of information. So if you want more, the easiest way is to go to Dr. Hansen's website at drhansen.com, or you can call the number you see right there on your screen.